Anatomy of the integument. Hello, my name is Alexandra Arnold, and I am currently a master's student at Liberty University. Today, I will take a few minutes to talk to you regarding the anatomy of the integument. Ezekiel 37:6 states, "I will put sinews on you, make flesh grow back on you, cover you with skin, and put breath in you, that you may come alive, and that you will know that I am the Lord." The integument organ, also known by its more common name, the skin, is the largest organ found within the human body. The skin is a member of the integumentary system, accompanied by the hair and nails. However, today we will only focus on the skin. There exists two different types of skin found surrounding the human body. The first is known as thin skin. Thin skin is most commonly found and is located in almost all areas of the body. On the other hand, the second type of skin, known as thick skin, can only be found on the palms of the hands and the soles of the feet. You can see from the photos on this slide, these two types of skin appear almost identical. However, the difference separating these two skin types from one another deals with their makeup of one of their layers of skin. This topic will be further discussed in the upcoming slide. The skin is made up of 3 layers, including the epidermis, dermis, and subcutaneous tissue. Each of these layers have their own characteristics and contain different building blocks from one another, making them unique. However, they all 3 work together to assist the skin in performing its overall function. The outermost layer of the skin, known as the epidermis, is the layer of skin we are able to see with our eyes. This layer of skin is primarily made up of stratified squamous epithelium tissue that is separated into 4 or 5 main layers. As highlighted in the previous slide, there exists 2 different types of skin that vary solely on the number of layers that exist in their epidermis. Thin skin contains 4 layers, whereas thick skin also contains a layer known as the stratum lucidum, which makes up the additional layer. The layers of the skin in order from deepest to most superficial include the stratum basale, stratum spinosum, stratum granulosum, and stratum corneum. This layer serves to protect the body against microorganisms in addition to assisting the body with any touch sensations. The epidermis is avascular, therefore all of the nutrients that supply this layer come from the layer immediately below the epidermis, known as the dermis. There are 2 important cell types to highlight within this layer of skin. These include keratinocytes and melanocytes. Throughout the 5 layers of the epidermis, there exists a variety of different cell types. However, 2 stand out from the rest and need to be noted. The first are keratinocytes, which are the cells located in all layers of the epidermis except the stratum basale, and produce and store the keratin protein. This type of protein helps to strengthen the skin, hair, and nails. These cells also help to give these structures their water-resistant property. As these cells age, they die and are slothed away before being replaced by new cells located deeper within the skin. The second important cell type to note is melanocytes. Melanocytes produce melanin, the protein that gives both the skin and the hair its color. Melanin also assists in preventing the cells of the epidermis from UV radiation damage. The next layer, as you move deeper into the skin, is known as the dermis. This layer contains hair roots, sebaceous glands, sweat glands, nerve endings, and blood vessels. The main functions of the dermis is to cushion the body from stress, provide elasticity to the skin, and notify the body to changes in touch and heat. The dermis contains 2 zones, including the papillary and reticular layers. As you can see in the photo above, the papillary layer consists of loose, areolar connective tissue. that serves to connect the epidermis to the reticular layer of the dermis through the presence of finger-like papillae that extend into the stratum basale of the epidermis. This layer also houses fibroblasts, adipocytes, lymphatic capillaries, nerve fibers, phagocytes, and a type of touch receptor known as messenger corpuscles. The reticular zone is the thicker of the two layers and consists of dense, irregular connective tissue containing a large amount of both elastin and collagen fibers. Elastin allows this layer to assist in the movement of the skin, while the collagen fibers bind to water molecules in order to keep the skin hydrated. This layer is also highly vascularized and contains a variety of sensory receptors and nerve endings. The final and deepest layer of the skin is the hypodermis, also called the subcutaneous layer or superficial fascia. As you can see from the photo on the right, unlike the other two layers of the skin, the hypodermis is less compact. The hypodermis primarily serves to connect the upper skin layers to the fascia of the bones and muscles through the use of areolar connective tissues. This layer also contains a large amount of adipose tissue that allows this layer to help provide the body with insulation, in addition to providing a layer of cushioning between the internal organs and the external environment. Blood flow to the skin plays an important role in maintaining body temperature, delivering nutrients, and healing the skin after trauma. There are two main plexuses that play a role in blood flow throughout the skin. The subpapillary or superficial plexus is the smaller of the two and is located between the papillary and reticular layers of the dermis. The lower plexus is larger and can be found between the dermis and the hypodermis. Although these are the main sources of blood flow throughout the skin, a variety of capillaries, venules, and arterioles also serve to supply the lower layers of the skin. There exists a variety of pathologies that affect the skin throughout the entire lifespan. Some conditions may be minor, while others are more severe. Some may be temporary, while others last for an entire lifetime. And some may require treatment, while others may not. The list of skin conditions affecting individuals around the world is lengthy. Therefore, only a few of the most common pathologies are highlighted in this slide. One of the most common pathologies that affects the skin is eczema. Eczema is an umbrella term used to describe a variety of different forms of acute dermatitis. This disease is most commonly associated with the presence of dry, itchy skin commonly found on an individual's hands, feet, elbows, face, and skin behind the knees. Researchers believe that eczema is passed genetically from one family member to another. However, it is yet to be uncovered whether there is also an environmental factor underlying this disease. This disease normally affects an individual for their entire life, but symptoms can commonly be relieved through the use of skin creams and medications. A second pathology that affects the skin is psoriasis. Psoriasis is an autoimmune disorder that causes the skin in certain areas of the body to become inflamed, red, and scaly. This disease is passed genetically from one individual to another and is commonly painful for patients. A long-term treatment for psoriasis has yet to be uncovered, but the combination of UV light therapy, prescription medications, and prescription shots have been shown as a positive outlook improving a patient's everyday life. The final and most serious pathology of the skin that I will discuss is melanoma. Melanoma is the most serious type of skin cancer and occurs when the skin, especially melanocytes, are subject to DNA damage due to exposure from UV radiation. It is estimated that this year alone, over 192,000 cases of melanoma will be diagnosed in the United States. Unlike other forms of cancer that share similarities in their symptoms from one individual to another, melanoma varies across individuals, making it difficult to diagnose during its early stages. However, if caught early, Patients diagnosed with melanoma will commonly have the tumor removed, leaving them with a good outlook of a complete recovery. As with other organs of the body, it is very important to have a strong understanding of the normal appearance and function of the skin in order to pinpoint common pathologies that could greatly impact a person's life.